Hello and welcome everybody to another podcast of the U of CARE. My name is Oliver Grundmann and I'm honored to be with Dr. Liana Hone. Dr. Hone, do you mind introducing yourself to our members?
Absolutely. Thank you so much for having me. So I'm Liana Hone. I'm an assistant professor in the Department of Health, Education, and Behavior in the College of Health and Human Performance.
Wonderful. Glad to have you with us today. So, Dr. Hone, would you mind telling us a little bit what got you actually interested in the field of addiction research and how you got to where you are now with your research?
Absolutely. So I had definitely a winding path. In college, I was very interested in sex and gender differences in young adult risk-taking. And one big risk-taking behavior is binge drinking, including drinking game participation. So actually very early on, I was interested in sex differences in kind of physiology and psychology. I was a physical health anthropology major. And I did a lot of work on sex and gender differences. And so then in graduate school at the University of Miami, I started looking more deeply into the psychology side of things, so the risk-taking behaviors. And of course, there are sex and gender differences in drinking as well as the consequences of that drinking, especially in young adults on college campuses. And so one of the big alcohol-related consequences is sexual assault. But in graduate school, I was a non-clinical Ph.D. And so I didn't really have a lot of the background in addiction research that I needed to really answer some of the questions about alcohol-related consequences. So I ended up doing two postdoctoral fellowships, one at the University of Missouri and another at the University at Buffalo. And there I really kind of started to dive into addiction science and how that was relevant for the study of alcohol-related sexual assault, because about 50% of sexual assaults involve alcohol use by either the perpetrator, the victim, or both. And so while I was at the University at Buffalo, I also completed my master's in public health to kind of get at the problem from kind of all sides, kind of tackle the issue with every tool that we have.
That is impressive. So first of all, two postdocs, one more in the South, one more in the North, giving you exposure to, I would assume, potentially different populations also. And at the same time, we're looking at sex differences when it comes to particularly the young adult, adolescent population, and alcohol as a kind of this disinhibitory drug of misuse and abuse, risk-taking behavior. When it comes to sexual assault, and you mentioned both the perpetrator and the victim being intoxicated with alcohol, where do you see differences if either the victim or the perpetrator are intoxicated? Do you see a difference in regards to either one or both of them being intoxicated?
Absolutely. So that's a great question. And there's so many things going on in alcohol-related sexual aggression. I mean, because you could have an intoxicated perpetrator and, or you could have an intoxicated victim who's being targeted by a sober perpetrator or some combination. You could also have an incapacitated victim. So there's a lot of different ways that there are a lot of different antecedents of sexual aggression, especially alcohol-related sexual aggression. And one thing that I've been recently interested in, when you think about alcohol-related sexual assault, you usually think about the intoxicating effects of alcohol. But something I've been more interested in recently is not only just looking at how alcohol can affect decision-making and behavior in the moment, but also the high-risk drinking situations that facilitate that and what sorts of individuals seek out kind of the more risk-related drinking venues like parties and bars.
Now, when it comes to sexual assault in particular, we often have to recognize that there is a specific burden on the victim to report sexual assault. And I actually don't know. I mean, we often say that females are obviously much more the victims of sexual assault, but there's also a small subpopulation where males are the victims of sexual assault. How is your data accounting or skewed in regards to actually reporting of this data, especially if the victim might herself or himself been intoxicated, where they potentially see themselves as being partially responsible because they were intoxicated?
Absolutely, it skews the reporting. So some things that researchers have done to sort of get at the rates of sexual aggression without necessarily, asking the word, have you been raped, because that's a heavy question to ask a participant. Some things that they'll do is use a measure with a lot of behavioral questions. So, asking things in a way that gets at whether it was rape or not, but without actually using that terminology. And so, on a behavioral scale, you can say, what a range of things from something like groping or unwanted attention all the way to fully incapacitated rape. Now, within that scale, if you introduce alcohol, right, you're going to get more skewed results as there's more and more intoxication. So a lot of times the intoxicated or incapacitated rapes are more fuzzy or harder to recount. So there's absolutely some issues there that some of researchers have been spending a lot of time kind of addressing these issues and trying to get at what the best way to ask these questions are. And so there's some exciting research going on in that domain.
I personally find it, I don't want to say fascinating, but I think the whole approach to the behavior that then impacts the actions that we take when we are intoxicated, or the consequences that are that we might not be aware of when we are intoxicated, no matter if we are the victim or we are the perpetrator in that moment. It kind of blurs sometimes the line between what the individual might consider is giving consent or not giving consent, right? When we talk about consent, where does consent, when do we need to obtain consent? At which points do we need to obtain consent? And that consent involves both parties. Both of them need to be able to give consent in a manner that we consider
enthusiastically.
Yeah, and so I think there's a lot. I kind of just recently I listened or I have started viewing 13 Reasons Why, which it has steered some controversy also as well, because it also has other themes mixed in with it among young adults and adolescents. So what do you think what are some of the major implications? We already addressed some of them, I think, when it comes to consent also, but I think you are going in a potentially different direction with it. What are some of your major implications of your work regarding substance use disorders and the future of addiction research?
That's a great question. So the work that I do is very much on the basic science side of things. So I study a lot of antecedents of sexual aggression or proxies of that in the laboratory. So in the context of alcohol administration studies, looking at how alcohol could impair judgments, especially men's misperceptions of women's sexual interest. And right now, as I mentioned before, I'm really interested in characterizing the role of drinking venues in sexual assault, specifically examining how alcohol and cannabis use and high-risk drinking venues could all kind of contribute. Like it's a messy problem to study. So taking little pieces of it is sometimes helpful. And I'm interested in what makes these venues particularly risky. So is it the proximity to secluded areas, or is it the intoxicating effects of alcohol? Is it the dispositional characteristics that predispose certain individuals to seek out these parties because they are, fun and do facilitate social interactions? And so, but really overall, my aim is to identify novel, both individual and environmental level targets for sexual assault prevention. So as part of that research, I did an alcohol administration study designed to test alcohol's effects on men's misperceptions of women's sexual interest. So for example, basing their sexual interest judgment on whether she's at a party or holding alcohol or at a bar, which sometimes can be misleading and cause someone to think that they might be interested in sex when they're actually just there to, meet a friend or something like that. And I found some pretty mixed results because alcohol administration studies are limited to relatively heavy drinkers, and they tend to have be higher in other personality traits. So for my next grant application, what I'm hoping to do is design a project to improve the generalizability of those studies. So kind of to bring that back to what are the major implications, I think the major implication would be providing kind of environmental level targets for alcohol-related sexual aggression. We spend a lot of time targeting individual level targets, like trying to reduce college level drinking or college students drinking to try to reduce sexual assault, with the thought being, if intoxication is really leading to these issues, then maybe if we reduce drinking, we'll reduce the sexual assault. But recently I found kind of effects of the drinking venue over and above just the level of intoxication. So there's something, risky about attending certain drinking venues over and above just how much you're drinking in those venues. So it'd be my hope to kind of target not just, reducing drinking, but also understanding what is risky about a certain a certain drinking venue, and kind of work to, make these drinking venues less risky. So I think definitely that would be an implication of my work, is separating out, what can we do at the individual level, but also what can we do at the environmental level, above and beyond just reducing college student drinking. So a long answer to your question there.
No, I think because we have so many factors that impact the interaction with a drug, the individual interaction with a drug. And I think venue, obviously the setting in which we consume drugs, if we consume them at a dinner table and we just drink a glass of wine with friends or in a family setting, that is very different from, going out with your pals or your bros or whatever, or, and you kind of might have, I can see that there is potentially a peer pressure to drink more. You are in a setting where you are encouraged to drink because everybody around you is drinking alcohol. Mm-hmm. So I can see that, but that's just a perception. There's no scientific evidence for that actually supports it in this manner. So I think it's quite important. Yeah.
Yeah, you're right on the button there. Maria Testa, a very prominent alcohol-related sexual assault researcher, just last Thursday at the Nebraska Symposium on Motivation said the same thing, that, you can drink in the privacy of your own home with the doors locked and there's no risk there, right? So it's not the level of intoxication that is solely an antecedent of alcohol-related sexual assault. It has to involve the presence of a perpetrator, the presence of a potential victim, and some kind of context, like you said, that facilitates the peer pressure and the acceptability and the norms of this sort of high-risk behavior.
It's, I guess we have a lot of work to do as a society to better understand and better facilitate a safer environment where we can still interact with drugs in a safe manner when it comes to alcohol in particular, which is a socially accepted drug, without the risk of becoming the victim of a sexual assault, or even when you talk about alcohol-related aggression, without feeling like you are going to be the victim of even physical aggression, which sometimes is the consequence of heavy alcohol consumption.
Right. And there's positives of the social college experience and interacting with your peers and learning from each other and, meeting your potential future long-term partner. So there are costs and benefits to be weighed in all of these risk-related behaviors, right? So people don't take risks for no reason, right? There are some positives there to be had, and we're trying to reduce the risk of the negative consequences.
So based on that and your research that you're doing, what do you think are the biggest challenges that in particular your research and the research community at large is facing related to substance use disorders and addiction from your perspective?
Oh gosh, so that's another excellent question. I think, so as I mentioned before, I'm more on the basic science side of the research. And so I think the biggest challenge facing the research community is perhaps a disconnect between basic science researchers and prevention researchers. I think society at large would absolutely benefit from the two sides talking more. And actually many researchers have started this process, which I think is excellent. It's important that we take what we learn in the lab, for example, studies like the ones that I do on alcohol's intoxicating effects that might precede alcohol-related sexual assault, and use that info that we find in the lab to develop interventions, but also conversely take what we learn in the field about what works, what doesn't work, what college students like to see in prevention programs, and have that inform the next kind of basic science study that we do, because it's worthless to do something in the lab if it's going to be not implemented in the, kind of the real world. And so I think a couple things that we can do are putting together conferences aimed at connecting researchers across the board, having journals that maybe publish both types of work that are accessed by both sides of the field could really bridge that gap. And I'll say one thing about University of Florida. I'm really fortunate to be here in health education and behavior because I have colleagues who do the basic science side of things. And I also have colleagues who develop prevention programs. And we also have other interdisciplinary folks like me who kind of maybe started in psychology with very individual level focused kind of prevention thoughts, like what can I do to reduce this individual's drinking level or risk for sexual assault, and kind of moved over to either health education or public health to realize kind of a top-down approach, like what can we do to make the context safer? Because like we said, reducing drinking is great, but if you were drinking at home, there's no risk. It's the drinking in the context of the party or the bar that is kind of where the danger comes in, where potential perpetrators are interacting with potential victims, and potential bystanders who might be able to intervene are intoxicated and not able to perceive what's going on.
I think that there's a lot of potential for so many basic science research projects that can really bridge over into clinical research if there was more communication, as you said, if there were conferences, if there were journals that would bridge some of these, I wouldn't say necessarily even gaps, because even you as you're saying you're more of a basic science research person, but just listening to you, I can already see the applications, right? Or what you at least projecting where this is going, where this can be going into the field. So me as a person who works in the College of Pharmacy, whenever I see research that starts in the basic sciences, I want to see how this eventually can go into the clinical setting, out into the field, the equivalent of when we talk about, something on your basic into the field setting. So I think that's what is being funded today, right?
Yeah.
Yeah.
Absolutely. I mean, I've seen a lot of colleagues at conferences bring this up as well, a lot of wanting to develop kind of relationships with colleagues who maybe have expertise in basic science, linking up with someone who has expertise in program planning to kind of walk that road together, so that we're constantly talking across those lines and speaking more about what we can all do collectively to make sure that our research is kind of informing each other, so that we're always doing something with the end goal of reducing risk.
Yeah. So I think your research obviously has a lot of implications, as you stated, and I'm sure that beyond UF CARE and our members within UF CARE, the research community, that many parents as well as young adults who are responsible, who want to be responsible with their alcohol consumption, and also don't want to be either a future perpetrator or a victim of sexual assault, will be quite interested to find out what your research will come up with in the future. So I look forward to seeing what comes out of your lab, out of your research in the future.
Absolutely. Thank you so much. That means a lot.
So thank you, Dr. Hahn, for joining us today. It was a pleasure. Thank you, everybody, for listening today, and look out for a future podcast. Thank you, Dr. Hahn.
Thank you.